What are the ethical concerns for optogenetics in humans? Imagine being able to turn parts of your brain on or off with a simple flick of a switch. That's what optogenetics aims to do, but it raises some serious questions. This technology involves inserting genes into neurons that make them sensitive to light. When light is shined on these neurons, they activate or deactivate. It sounds like science fiction, but it's real and advancing fast. One big concern is that optogenetics causes permanent genetic changes in the brain. Once the genes for light-sensitive proteins are added, they stay there. This means the brain's wiring is altered forever, which raises questions about safety and long-term effects. We need to know if these changes could cause problems years down the line. Another issue is how we test this technology in humans. Clinical trials must weigh the benefits against the risks. Unlike drugs that can be stopped or adjusted, optogenetics is a one-way street once the genes are introduced. This makes informed consent tricky because patients need to understand that the effects are irreversible and long-term. Getting consent is even more complicated with vulnerable groups. For example, people with neurological disorders might be desperate for help, but they could feel pressured to participate. Researchers must be careful to avoid coercion and ensure participants truly understand what they're agreeing to. There's also concern about using optogenetics for purposes beyond healing. Some worry it could be used to boost cognitive abilities or influence behavior, raising ethical debates about fairness and societal impact. Would only the wealthy have access? Could it be misused for mind control? These are questions we need to answer. Regulatory rules for this kind of gene therapy are still catching up. Existing laws might not fully cover the safety and oversight needed for optogenetics. This gap could lead to unregulated use or unethical experimentation. Animal research is another ethical challenge. Scientists often test optogenetics on animals, including primates, to understand how it works. While necessary, it raises questions about animal welfare and whether the benefits outweigh the costs. Finally, if optogenetics becomes a common treatment, access and affordability will matter. Will only wealthy patients be able to afford these advanced therapies? Could this widen existing health gaps? In the world of brain-computer interfaces and neural implants, optogenetics adds a new layer of complexity. It combines gene therapy with implantable devices, making the ethical questions even more pressing. While it offers hope for conditions like Parkinson's disease or blindness, we must carefully consider these concerns to ensure responsible use. Overall, the main ethical issues revolve around the permanence of genetic modifications, informed consent, safety in trials, regulatory gaps, and societal impacts. Addressing these concerns is key to advancing optogenetics safely and fairly in human health.